African Americans have lower rates of metabolic syndrome, higher rates of insulin resistance. Despite higher rates of obesity, type 2 diabetes, and hypertension, African Americans have lower rates of metabolic syndrome when compared to Caucasians, which is paradoxical, since African Americans are more insulin resistant and have higher rates of cardiovascular morbidity and mortality when compared to white Americans. Mays et al. Hypothesized that genetic inheritance predisposes African Americans to the greater cardiovascular risk and the associated morbidity and mortality. Therefore, they investigated the prevalence of components of metabolic syndrome in obese, glucose-tolerant, first-degree relatives of African American patients with type 2 diabetes. They found that, 1. The prevalence of metabolic syndrome is higher in a subgroup of African Americans who were first-degree relatives of patients with type 2 diabetes than that of African Americans in the Haynes 3, and 2, waist circumference rather than metabolic parameters was the single most important parameter and was more likely to meet the metabolic syndrome criteria in African American relatives.